New healthcare system, there's some big problems with it. Good doctors in all specialties are having a problem. I never say no when a patient comes here based on money, ever. We never go nothing because of money. People come in, our payments over the years have gone down. I have one insurance that pays me $11 a month, unlimited visits. You never know who that is because we treat everybody equal. Some doctors say you can't come in but once a year. We never would do that. Who's going to go into healthcare down the road? The cost of being a doctor today, Ph.D., M.D., whatever it is going to run you $300,000-$400,000. And down the road it could be double that. How do you pay it back? Well, they're paying back. They're not. We want to get people to go into it. You're going to make it, you're not going to get rich, but at least attract enough to say, I can pay my bills, go to school. I don't see that down the road. Am I wrong?
My daughter is currently in a Ph.D. program, and she's now accruing about $180,000 worth of debt.
Which is small.
Yes, it is. Mainly because we're subsidizing her. If it wasn't for that, yes, it would be twice that. I'd like to see some incentives. I spent the first several years of my practice, my career, working in public health. The reason was that I got forgiven loans, and I just couldn't. I knew that I'd have trouble paying them, so I purposely went into the public health, state health system, got my loans forgiven, and wound up staying in the system for 17 years.
Now I get a question for it. See, this makes sense. The new healthcare bill Obama experts came up with, add one thing to it. Here's what I want to add. You go to medical school, become a Ph.D. in some health-related area, see the uninsured for free, no income to you, and get a reduction in your school loan. That could be $60, whatever the counter's worth, and you could work off the loan. See, the threat of that horrible loan to pay every month is taken away. And I also find out those patients that you get exposed to that uninsured sometimes get jobs. And they're going to become your best patients. The most, that guy was there when I didn't have any money. And you treat them the right way. You just made the best reputation in the world. Good doctoring, good caring. That attracts people, doesn't it?
Sure does. I have the same policy. I never turn people away. I take every insurance plan, and if they can't pay, we always figure out something.
That's the way it should be. And when I grew up, my father got very sick. He was a pharmacist. It took him 5 years to die. The interns in the area took care of him, and we had him in various hospitals. Never sent a bill to my mother. And one day I sat down and said, why? Well, when I opened my office, your father sent me everybody because he knew I was a good doctor. And I never forgot that. And now I think you want to be a doctor. Remember what I did for you. Now, of course, we gave him a great gift when my father died and everything. But he was always that way. And the patients always could find him. Today I'm finding big group practices, and you got Harry on a Monday, a Judith on a Tuesday. There's continuity of care is lost. There's no personalization. There's no extension. I think a good doctor is sort of an extension to the family. And a good pediatrician should be that, and a good intern. Not anymore. It's obstacle. You get someone at the front desk answering questions. That's not what you want. You want to speak to that extension in a very nice way. That would be a better healthcare, wouldn't it?
I like that idea very much.
When I grew up, I remember Boston Children's. There was never a no. A kid was in that ER, had to be admitted. They found a way. There was a thing called the Jimmy Fund for the Cancer. I came to New York. I made contacts at different doctors around New York. I knew I could get a cancer treated without insurance. It's very tough. You get the wrong insurance, they send you out of the ER now. This is horrible. It's not health care anymore. It's health business. I'm going to go back to health care.